So we just dismissed a sedation patient for training purposes, and I'm just going to go over the room with you. Over here we do have the handpiece unit, okay? And then this is our nitrous unit. If you're not using this for the sedation, we have the nasal cannula, and that would be hooked up down to the wall here. That will give us our oxygen. Over here is the suction for the adapters. Here's our chair. Up here is our light. Over here is the tray, the cart for the procedure. Our IV pole with our IV. Our CasMed cart for our blood pressure cuff. The leads, pulse oximeter, and where the capnograph connects to. Over here where our sedation drugs would be. Okay, that would be the first thing to do is remove the drugs. Whatever is not used would be flushed out of the syringe and discarded. So I am adding all the instruments back to the cassette that we removed from that. And then it has to be sealed and closed all the way here. Of course it's not linked. I want to make sure it clicks, okay? These are the extra pieces that did not go in there. So I'm going to add these to the basin. I'm going to take my bowl over to the adapter because I don't want it to splatter. I will carry it back over with the bowl here. Same thing, you want to take this apart slowly. You don't want splatter. This comes apart in 3 pieces here. We also use the handpiece in this room. I will also grab this garbage now and just add it to the wrap here. In this instance, we would have used the sterile drape cover that was inside. It was already discarded, so what I am doing is just wrapping it inside of the cassette cover for now to take it to sterilization because there is no lid. I just placed the cassette here with our instruments. With the handpiece, what you'll do is twist to the open, pull out the burr that was used, You want to shake up the new clean spray. Spray for 3 seconds. Okay. Add the burr back on. Now if this was for a 20-to-1 handpiece, that adapter is stored in here. Same thing, you want to spray the bottom and then attach this here. This is the 20-to-1 here too. So with this one, you would spray this in this part here on the head. I'm going to grab the bucket now, which is underneath here for the evacuation system cleaner, which is also stored here as well, along with the teeth for if we're saving for students, it's going to be in this jar. Any teeth with amalgam, they will go in here so they can be properly disposed of to amalgam waste. For the dentures or crowns, they would go into this jar here. Any teeth that are not savable, we will put those in the sharps containers because those are considered medical waste. Wipes are located down here, also next to the sharps container. I like to grab 3 at a time because they do dry out fairly quickly. So instead of grabbing one all the time, it's already there in your hand. You want to wipe the holder here. Wipe the hose line. I like to also run a little bit there, make sure that it is clean, and then also wipe the hose to the suction that you did not use. All these hoses that are in this area. If it was for the local and you used the nitrous, there would have been a mask here. Discard the mask. They're single use for every time. You want to wipe these hose lines here. Okay. Especially pay attention to the females. Sometimes there is foundation that does stay behind, so you want to definitely make sure there's none of that. Wipe this where it was resting, also the nozzles. Same thing, you want to wipe the hose here. I'm grabbing the wipes down here, which is located right next to the sharps container. They're coronary disinfectant wipes. I'm just going to place them out for the surfaces that will be used. I grabbed 2 for the chair. I'm going to take the hose and run for 5 seconds in our solution. Also, grab this brush. You want to clean out the inside. Make sure that there's nothing visible that you can see. Then run it again. For this, I will also clean the holder here. Clean this line here. You want to run and clean the hoses next to it also. Let it go inside a little bit. If the nitrous was used, you would discard the mask that was on it. They are single use for our patients. You will want to wipe the hose here. Really pay attention to this top part here. If it was for a female, their foundation, their makeup likes to stick to that, so make sure that is not there. Wipe all these hoses down here. Wipe where it was resting, and then also the nozzles. The on-off switch. Place it back where it was clean. Over here, you will wipe the motor. Wipe the side where the holder was placed, the holder itself. Where you connect the motor to and the hose for it. You want to get the whole cord. Wipe the handpiece motor, the side of it, lift the holder itself, wipe underneath it. Make sure there's nothing to visibly see. You want to make sure every surface is also wet for 2 minutes whenever you're disinfecting, for the disinfectant to properly disinfect. Wipe underneath the front of it where debris can fall underneath. Wipe the back counter. And then also wipe the patient glasses. Remove the barrier to the light. You want to wipe the light handle, the light itself, these side buttons here. Turn it over, also wipe the back side where your fingers touch as well. Wipe this part again, and then this is where you want to put it back into position. Wipe the cart 360, so you want to wipe the top. Get all of the sides. Also the legs. Next you want to get the chair, remove the cover. You want to get the straps. Recline the chair so you can get to the inside where the seam is in between. Wipe in there. Remove a snap so you're able to clean underneath. Put the chair back into its home position. Unsnap it, that way it can completely dry before going back on. Wipe the back side of the chair. Make sure it's in the pedal position. Sometimes it comes off of where it's locked. It is now. There it goes. You'll hear it click into place like that. wipe these handles where you adjust the chair. On the side. Also hit the base here. I'm going to walk around and do the same thing onto the other side. Discard of anything dirty that is on the counter. Wipe the counter. Wipe the sink. Wipe where the white container was. Place it back. Wipe the handles and the cabinet door to where you are touching. So now this is for removing the patient from being sedated, all the leads and cords. Okay, so we already disconnected the patient. So all these already have been removed. So I'm just going to wipe them off one by one. Normally what we would do is while they're taken off the patient, we would be wiping them down each one at a time as we go. So they're being cleaned before we are putting it onto the CASMed machine. Wiping the cords as we go up. Same thing with all the cords here. You're going to wipe everything. Before placing it back on the holder. With the nasal cannula, those are all disposed of. Every patient gets a new one. Also, we already removed the IV, so all of these are disposed of also. You want to wipe down the IV pole. And the legs to the pole. With the sedation, we also use a precordial, so make sure all is wiped. I'm also going to finish and grab the handpiece, wipe where you had it resting, and then also the bucket to return to sterilization. Place the bucket back in the cabinet. You want to put the handpiece in the eye care unit. Make sure the coordinating light is on for the one you're wanting to use, and press start. Grab a new adapter. Without touching the adapter itself, pop open with the sleeve here. Connect it on here. Sometimes the lever is up, so just push it up through. You want to clean the room of all debris, so you want to sweep. If there's any tooth fragments, sutures. After sweeping, you do want to Swiffer the room. You also want to get the doctor's chair. Also get the patient chair that are in the corner here. Now that our room is clean, we can remove the clean items and put those away. You also want to click out of the patient's chart. Make sure no windows are up all at the same time. You want to lock the screen. Also clear the boogie board with all the patient information. Like I said, make sure everything is off of the counter that doesn't need to be out. After wheeling out a sedated patient, you want to wipe down the wheelchair also.